Hello everybody. Today I have the honor and pleasure of welcoming with me in this damn studio Dr. Madan Shivakumar. He is from Mysore. Congratulations Madan on getting a rank of 48 in AIIMS November 2019 and rank 7 NIMHANS MD Psychiatry exam conducted in October. First of all, welcome and congratulations. So first, how are you feeling now?
I'm feeling very good about this result, sir. It was a bit uncertain when I was preparing. During the preparatory phase, I was not sure whether I would make it this far. But now that I'm here, it feels grateful and it feels a lot satisfying than when I started.
Very good. So, when did you start your preparation for AIIMS actually?
So actually, for AIIMS, I had specific preparation plans post, say, March or April. So I knew that I had to do something different and I had to follow specific subjects and topics for succeeding in AIIMS. So that was going on simultaneously, but predominantly I stuck to the notes which were made in the DAMS classes at my satellite center. And I think there is a necessity for understanding the basic concepts as well. We cannot always do a targeted study just for the sake of one exam. If we have a baseline knowledge of every subject in general, I think that will be of great use even in succeeding in an exam like AIIMS, because many times we end up creating perceptions that AIIMS is a difficult exam or of very high standard, but actually they just test you whether you have understood some topic in its full depth and maybe the clinical aspect or things which you would commonly encounter in our internship or maybe in the emergency department. So and also how much we have actually seen in our hospitals during our MBBS. So it's a conglomeration of many factors, I feel, and I think the responsibility of a student is to bring them all together and to make something meaningful out of it in the exam to succeed.
Okay, so how was this paper actually, AIIMS November 19? As compared to any other AIIMS paper if you have seen or attempted?
So I attempted the May AIIMS as well, and I felt the difficulty was of a similar level. Actually, I was among the first ones to attempt the new pattern which was conducted in May AIIMS, and contrary to perhaps popular perception, I felt that the new pattern was better than the old pattern because it just cuts down a lot of luck factors. I think when a person has to succeed in this kind of a pattern, he needs a lot more preparation in terms of the concepts and the clinical aspects and situations compared to just mugging up the notes. So I feel this has its own advantages. I think it might be intimidating at the beginning. I saw that in the initial few tests and CBTs that I gave that I was facing shortage of time maybe, and probably it was difficult to read all those questions in detail because AIIMS likes to bring in many different departments in one question. They don't generally give you a single line question and the options. So I think there is a need to think quickly and react quickly. It tests your decision making skills a lot. I felt if your decision making skills are fairly up to the mark, you can succeed in this exam.
So as what most students are saying, 150 were single best response and 50 around were new pattern. Which do you feel more comfortable with?
Actually, single best response, I had this preset mindset that I have to do a lot of them. I attempted a majority of them, I think around 143 or 144. I think among the rest of the sections, I felt that true or false and assertion reasoning questions were a little bit tricky for me personally. I felt extended matching section was fairly easy because even though the questions are lengthy, the arrival of conclusion is fairly straightforward, and the answers are actually easier than most of the people think. So I think this was the breakup, and I think you need to point out the areas where you need to strike hard and you need to go aggressive, and there needs to be an awareness in general that where you have to hold back and probably be less aggressive and conservative in those sections. And I attempted around 275 out of 288 questions in general. So I think that's very important to keep in mind. Though we say 200 questions, it's actually 288 questions. So I think it's necessary to have a topography of the whole paper in mind while attempting those questions. So I think I probably went a little less aggressive on those sections which have high risk, high reward. So I feel that was my strategy in general.
Okay. And were you able to manage time, or did you feel short, or?
I think in this aspect, it's very important to give a lot of practice tests, especially for AIIMS, I feel, sir, because NEET exam, 300 questions and a lot of time is left at the end. I think at least if you're prepared well, at least 20-30 minutes are remaining in the end. But AIIMS exam is not like that. I think by the time you spend a lot of time in single best response, you'll find that you're left with very little time for the remaining sections. I think many people will attempt a lot of single best response questions, and many people will get a majority of them correct, but the rank deciding sections are the remaining ones, the remaining 6 or 7 sections. So I feel in order to plan for it and be ready for it, it's best to give a lot of mock tests and grant tests to be acquainted with the overall pattern and how you need to manage time in those areas. So probably I gave around 4 or 5 mock tests for AIIMS in specific, and I felt initially my rank was in the thousands, and gradually I climbed up and I felt that I was at ease with the pattern by the end. That is when I gave my last grant test before the main exam.
Okay, okay. Do you think that students should prepare anything specific for the new pattern, or the common preparation is fair enough?
Actually, I feel students who are in MBBS, who are yet to get into this grind of PG preparation, I would advise them to actually read the textbooks and be acquainted with their basic concepts, because AIIMS, I feel when you just isolatedly sit with an AIIMS paper, whether it's a practice paper or even in the main exam, you'll feel the beauty of the paper lies in its basic concepts. Like, for example, they ask you the most basic things like this time you had a Jackson Pratt drain, which many of us wouldn't have seen generally. But if you're acquainted with a standard textbook, maybe you would feel comfortable answering those questions. And I think those kind of questions make the difference also. We get the basics wrong. For example, a question like shin splints, where we encounter those situations. We actually even see a few of those cases among our peers, but we wouldn't have investigated further into what those conditions are. So, be it something like named fractures or probably some concepts in general surgery. I personally saw people who have made mistakes in monopolar cautery, which was asked, and it's a very common thing, and which is a possible trap for the students where they make mistakes. So I feel you cannot afford to get your basics wrong. You can probably afford to do a few tough questions wrong, but you cannot afford to get your basics wrong. So when you are doing a post-internship style of preparation for AIIMS, I feel it's better to stick to the notes in thorough. I think you need to be very thorough with the notes, and with each concept and with each topic. You cannot perhaps skip anything in saying that, okay, I'll read this and I'll be successful in these questions. So if you have the skill of ruling out options so that this definitely cannot be the answer, I think you have a greater chance of succeeding in an exam.
Any particular subject the student should stress more upon if he is targeting AIIMS?
So I think generally it is common knowledge that the minor subjects are little less represented in AIIMS. I think the 3 major giants, that is surgery, OBG and medicine, are well represented. And I think PSM, this year it was a sort of a googly or a bouncer, if you would call it that, because no biostatistic problems were there. But that may not be the case every year. So PSM is and continues to remain an important subject. And I think, having said that, we can only probably lay out these roadmaps that these are important subjects and we need to focus more on them. But I feel even if you get a few things in psychiatry correct, a few things in ENT correct, that will only add to your score rate. I mean, the final rank is a conglomeration of all the questions. So we cannot afford to take anything easy if you really want a good rank in AIIMS and get into the top institutes. But I think overall the emphasis can be on the major subjects, wherein surgery, medicine, OBG and the first year subjects, which I thought were very well represented.
So you started your preparation this year in March itself?
Yes, sir.
With our Sky regular course.
I was a student of DAM's satellite course in Mysore.
So how did you study with the regular course? How was your weekly schedule?
So actually, initially the residual effects of January NEET exam were there. I think many of us were not really into the groove. I think we were attending counseling a little bit and probably not concentrating that much for the initial 10-15 days. But then once you get into the groove, it's important to have a schedule and a discipline in your reading, I think, because aiming randomly and studying from too many aspects and too many angles is not going to be useful. I think you need to focus on a certain few aspects, and if you stick to a source, I think you need to trust it and go along with it. And especially when you're sitting in a regular course, when you're sitting in a class for 12 hours and you're probably hearing the subject fully, I think we need to be involved in the class, and that makes a huge difference. When you hear each word and make it with your own hands, it makes a lot of difference. And when you recall it after going home, when you do your first revision, you'll know the difference than when you would read it from a source which is not made by you. So you have to build on that. I think this whole journey is all about picking on the little rewards that we get. Probably initially a few subjects might be your weak points, but we need to focus more on that and spend some extra time on that and polish them as we move on. And I think I had this habit of giving the mock tests and GTs pretty early in my preparation, and I would advise that to any future aspirant as well, because it's not just enough to know the subjects in detail. Yes, you might be very thorough with your notes and you might be proficient with what you're doing, but if you're not putting them to the fire for the test, it's going to be difficult. So I thought doing GTs early is a very good strategy from my point of view, because even if you make mistakes, even if you get bad ranks in the initial stages, it's better to review them and focus on your weak points. And in that way, I saw a lot of motivational videos from Dr. Sachin sir and Dr. Sumay sir, where they just keep pushing you to take the leap and take the jump into doing GTs and actually finding out your weak points, because whatever we know well, we are obviously going to do it well, and if you're not going to improve on your weak areas, your rank won't improve. So I think that's very important. To continuously improve should be the goal, I think.
You said that you were initially busy with the NEET counseling, so you started by March.
Yes, sir.
So NEET, your rank was?
So my January NEET rank was 7,300. I had an opportunity of probably going for a seat, but I decided that it's better to give a full-hearted effort this year.
So you started full-hearted effort by March?
By March.
Joining the regular batch.
Yes, sir.
So how did you follow up your preparation from March till October?
From March till October, as I mentioned, I had this idea of just making the notes properly by sitting in the class, and after going home, I would give my first revision preferably on the same day.
Same day, yes.
So that just I get acquainted with the overall scheme of what I've written. Not that I wanted to be thorough with each word, but I wanted to be thorough with the overall framework. That perspective was important from my point of view. And later, probably 1 or 2 weeks later, you need to revisit what you've written in the last 2 weeks, and probably revisit it just for the sake that to see how much you have forgotten. Because even in class, I remember you sir saying that we retain only 30 to 40% of what we have read in the first reading, and that's an important thing, because, for example, I now recall that our psychiatry class was pretty late in the year, and it was close to the DVT. So psychiatry, I had already made the notes and I had revised them once before the DVT. But during the DVT, when I was given specific situations and asked concentrated stuff about the particular topic or the disease, I found myself lacking. So I saw that many of the concepts had evaporated out of my mind. Even though I had an intuitive idea of what the option might be, I couldn't actually involve myself fully with the question. So I think once you get that realization, you need to go back to the book, because the effect will be there in the mind. So at that time, if you go and read it back, I think you'll retain it for a much longer period of time. And it's an added bonus if you have friends who can discuss the same things with you, and probably you can end up arguing over certain concepts and probably driving them deeper into your head. I think that will help a lot.
So DVT was an eye-opener for revision?
Yes, the DVT was definitely an eye-opener, because I think in the regular classes we sit for 12 hours, but we focus on the same subject. So I think we'll pretty much be involved with the subject, and we'll have a sense of carelessness that okay, we know this. But in the DVT, it keeps randomly moving. It's dynamic, it never stays static, and it forces you to think in a way that you would normally do in the exam, where you have to move from one subject to the other quickly, because it's easy to get stuck on one subject. Probably I can sit with surgery or OBG and study for 5 days, but that's not going to help me in the exam, because my thinking has to continuously shift from one landscape to another to be successful in the exam. So in that sense, for the sake of simulation, DVT was a very useful tool.
So the weekly schedule was you attended a class, read notes, then how did you follow up the remaining week?
The remaining part of the week, I tested myself probably with a few SWTs in between. SWTs and grant tests or subject-wise tests are very important in the sense that in a subject you might feel confident, but there may be a few grey areas and a few traps where you wouldn't know the answer, or you probably wouldn't have read the concept in its full entirety. So I think to mop that up or to polish your overall concepts, you need those things also. And if you get a good rank in those tests, it's an added bonus, because it's only going to boost your confidence. And perhaps I was more bent on discussing certain aspects with people who are close to me, because I think speaking it out and probably teaching it to someone will enhance your learning as well. So that's only going to help you in general. And that's it. You have to be thorough with your schedule, with your class notes. You have to read that in its entirety, and you have to apply it in the subject-wise tests, in the grant tests, and in the mini tests that are there on the eMedicos app and DAMS Test Series app. And probably if you need a mop-up, you can refer to the CRS. I personally did not refer to the CRS that much. I was trying to polish my concepts within the notes and perhaps trying to gain whatever extra I get from the CBTs and the grant tests. But
DQB you tried? No.
DQB I attempted, sir. Whenever I was free, I have made it a point to see extra questions in that, because I felt that some questions appear directly from that, because especially in a subject like PSM where you have a lot of numericals, I feel it's very important to gain as much as possible in the form of questions, because no matter how much you by heart a formula, that's not going to come in the exam as a direct question. It's only going to come as a sequence or a scenario or a situation which you need to see multiple times and which you need to be thorough with. And for example, some questions they are going to be repeated. For example, you're going to get repeats on certain aspects of surgery or OBG. You're going to be asked about endometriosis. You're going to be asked about certain concepts in radiology like MRI sequences. So the more you see those questions, the more spinal your response in the exam will be, so that you can save time for the other aspects as well. So that's very important, to be in the practice and to be in the groove with doing a lot of MCQs.
And then when you started it in March, you finished the course with us by September. Yes. By DVT. How did you plan the last 1 month?
Sir, actually a lot of information gets circulated, and personally I felt a bit overwhelmed after attending DVT, because I felt there were still a lot of lacunae and grey areas to cover, because I did get the nervousness that there is just 1 or 2 months for the AIIMS exam, and considering the enormity of what was happening in DVT, I felt it's going to be a tough shot to actually cover those last remaining miles. But I think in that time it's better to shut yourself a little bit. It's not actually useful to be on social media for a long time in that kind of a scenario and take in a lot of advice. I think it's better to take advice from 1 or 2 trusted sources whom you know will advise the right thing. And perhaps in that sense, I feel scheduling is very important. I think each day counts, each hour counts, each half a day counts in your preparation. So I think I remember Sachin sir having put a few posts regarding scheduling in specific, that from this month to this month you have to plan. Those 30 days have to yield you maximum result. There's no point in saying that for 5 days I'll sit with this subject, or for 10 days I'll sit with this subject and then take it forward from that. I think you need to plan on a day-to-day basis, and I think it's very important to focus on your specific weaker points, because what is a high-yielding topic may not be your weaker point or your stronger point. I think if you are weaker with say diabetes insipidus, or you are weak with something in biochemistry, it's better to read that rather than going with popular perception or opinion, because you are going to write the exam and you know how you think or your thought processes upon seeing the question.
So last 30 days you managed to revise mainly the class notes. What else?
Yes, last 30 days I had an idea of revising the class notes in entirety, all the 19 subjects, and I think I was fairly successful. I may not have been able to complete 100%, at least for the agenda that I had set for myself, I was able to complete it. And I gave at least 2 or 3 grant tests in that period. I think 1 of NEET pattern and 1 of AIIMS pattern. So that's very important. Definitely in that last 30 days you need to test yourself. You need to find out what thought blocks you have in the exam in particular, because for each person, upon seeing the subject questions of one particular branch, you might feel a little apprehensive or hesitant to mark the answer. So for me it was say biochemistry, or probably I was not that good at radiology, so that I had to polish those things up. So in order to get that realization, I had to give a lot of tests. So I did that, and I think I was successful in that.
Did you see the previous papers of AIIMS?
Previous AIIMS papers were uploaded on eMedicos, and I had a look at them and the solutions as well. And I think repeats do come from the topics that are usually asked in the AIIMS exam. And it's very necessary to have that realization, because these topics can repeat. For example, in general surgery, instruments are a neglected topic. DAMS being a visual based exam mainly, I think you need to have that realization that these subjects are more likely to carry a large weightage, and these particular topics can repeat in the further exams as well. And it's only going to boost your rank further, because your preparation will go on as usual. But if you know the often repeated topics, if you are perhaps more aware of those topics, and if you attempt them mindfully, I think you'll end up with a better score than when you just go in with an open mindset without probably a big idea about the paper.
And during the course of your preparation, while during these 6 months, notes, GT, SWT, you read them. How did you actually assemble them in the last month?
Sir, it's very important to see what works for you, I think, in that time period. I think if you feel you are not good with your basic concepts, I think you need to focus more on the notes. And if you feel you are at a particular baseline and you need to take it further to another level, I think doing tests and SWTs is a better option in that period. And I am saying at the expense of the other, the three or other two aspects. Like if you are okay with the notes, if you are fairly confident of the notes, I would advise you to attempt more tests and SWTs. If you are actually feeling that your concepts are at a low and you need to brush up them, then I think reading the notes perhaps another time wherever you're weak, that makes sense. And I think it's not just enough by giving tests, you need to analyze them in detail. Like you have to see where you specifically went wrong. And I think in that sense, if you try and analyze on how you're thinking when you look at each question or how you're reacting towards each question, that will make more sense, because just knowing the answer is not going to help. Knowing how you arrived at that answer or why you made that mistake makes more sense than actually knowing the answer as a rote memory. Yes.
Other than past year papers, what else did you see on eMedico's app?
On eMedico's app, I think the DVT videos which were uploaded, that were also very helpful, because many things you would have realized in DVT that you don't know, but they're volatile. They disappear in a few days. I think if you open the same videos after a week or 10 days, you'll not feel the same level of confidence like you did when you sat in the class. So it's very important to go back to them and see where you actually felt uncomfortable or felt uneasy, and probably study them a little further. And I think things like the question of the week, wherein every Wednesday you get a particular MCQ and you discuss that in detail. For example, I remember the question on SGLT2 inhibitors by Dr. Thiru sir, where specific concepts which you wouldn't normally study in the notes, you get to hear them at least. Even if you don't study them later, at least you get to hear them. And even the questions on psychiatry, where every week there is a particular question. For example, in phobia or OCD, you might be knowing certain baseline things, but you might not know whether it comes under DSM-5 as a new disorder or if it is classified as a different disorder right now. So I think those important criteria make a large difference in the main exam, because specifically they are asked on those particular areas. They don't ask about what is the definition of something or how prevalent. I think that is very important. For example, they ask you about suicide prevalence in schizophrenia. That was covered in the DVT. You might not have written it in the notes, but if you look at that and if you recall it in the exam, it's still a bonus. So I think it's necessary to cover those peripheral things. For example, discussions or short videos or motivational videos, where you get to cover up your preparation very well. It's not necessary to add more bulk at that period of time in September or October, but you need to pick those small points where they can make a lot of difference in the main paper. That is important.
You also secured rank of 7 in NIMHANS MD Psychiatry exam. Actually, at that time I couldn't meet you.
Yes,
how was your experience with NIMHANS paper?
I felt the NIMHANS paper was a standard paper. I had no prior exposure of giving an NIMHANS exam, so but I had gone with no expectation in general. To be honest, I decided to give the exam 2 or 3 months back, but that was mainly for my exposure, I felt, because NIMHANS was a well-rounded paper which tests you in concepts. And I knew that psychiatry was the only subject in this session, and specifically that's why I made sure that I made my psychiatry notes in as mindful manner as I could, because in the class when you listen to the scenarios, I think psychiatry is a subject which you can relate to with your peers and with people who are there around you, rather than actually sitting with a notebook and studying. And that aspect, I think it was a very enjoyable couple of days in psychiatry. I hardly looked at my watch, and I did not feel the fatigue of the class. So I felt I had made a very neat and rounded notes, and previous day I was sitting with my friend in the train traveling to Bangalore for the exam, and I just breezed through the notebook in a couple of hours. So I felt it was really useful to do it that way, because I think finally more than actually filling your head with a lot of information, I think the concepts are very important. For example, in this NIMHANS paper also, there were a lot of clinical scenarios. I think they ask you specifically, they give you a situation of a person who is in a particular psychiatric disorder, and they ask you whether it's probably delusional perception, or whether it's an adjustment disorder, or it's a depressive disorder. So in that scenario, each and every line which is said in the class matters, because a particular word in the question can make you rule out a particular option and rule in another option. I think that's very important in NIMHANS. If there is a particular question, it makes you come to the diagnosis very clearly. You don't need to beat around the bush a lot. And also I feel NIMHANS, in that sense, you cannot only focus on psychiatry also, you need to focus on the other subjects as well. You need to be a well-rounded person in your PG preparation to do well in NIMHANS exam, because almost 70 to 60 questions came on the other subjects as well. Even the basic sciences were covered, anatomy, physiology, biochemistry, they carried marks which could make a lot of difference in the final rank. And I think gynecology was well represented in this NIMHANS exam. So it is necessary to have a general knowledge of all the 19 subjects, but I think psychiatry, as they say, is the major determinant and a player. And I thought, I think maybe the lesser amount of pressure that I put on myself in that time, I didn't have any expectation on myself to do that well. I think that helped me to maintain my calm and probably do that well in the exams.
In common paper, you think all the subjects are important for NIMHANS?
I think you need to definitely focus more on whatever you are attempting in that session. I think if psychiatry is the thing which you are aiming for, you need to have a clear view. You need to be really perfect in psychiatry. In terms of concepts, I'm saying maybe you might not have read every material, or definitely you might have not finished the entire course, or probably having an exhaustive knowledge of DSM-5 or something like that, but definitely you need the concepts. And probably in that sense you can follow the psychiatric capsule which is being conducted separately by second sir. And I think the questions, basically you need to get in the groove of doing MCQs rather than actually studying theory that much, because many of them being scenario based and situation based, you need to have those particular techniques or nitty-gritties of ruling out options in the NIMHANS exam. As an adjuvant, I think having a basic knowledge of all the subjects is only going to help you in the exam, because they are going to boost your rank further and probably push it into double digit or single digit.
And common paper, most of the subjects were asked.
Most of the subjects were asked, and I think probably most of them were basic questions itself. You don't need to break your head that much. If you already have a good knowledge of your notes and you're in the habit of solving a lot of MCQs, I think that should be fine, and you will do good in the other subjects.
Okay. How was your overall experience with DAM Sky Mysore classes?
I think the classes were very well conducted. Initially, I thought the start was very good. I think Sumesh started off our session by his radiology book. His image book actually gave us a lot of reassurance that okay, our PG preparation is going to go well from this year. So I think it's necessary to remain positive, because there are a lot of factors which can put you down. I think the general mood that okay, what do we actually gain by sitting for 1 year, that actually pervades the atmosphere in the first 1 or 2 months, because a lot of people will be taking seats and going, and you might feel depressed that okay, why did I even choose to sit for 1 year? But I think it's all about your individual perspective. I don't think you should overtly listen to advices at this period. If you feel that you are good enough to clear it in the next attempt, I think you should take the chance and you should sit for that extra year. And I think having a close circle of friends around you definitely helps. They obviously help keep you in the right spirits in the class and outside it. I would like to thank my parents because they supported me, and they handled my eccentricities in that period, because being in that kind of a scenario where you sit for a lot of time and you don't actually have a lot of physical activity, you're not going out and meeting a lot of people, can put you down. It can send you into that little bouts of feeling low and feeling depressed. So it's very important to have a support system to probably lift you up in that period, and I think I have to thank my parents and my relatives for that. And I did have 1 or 2 very close friends who were studying along with me for this, and that helped me a lot in my preparation. And basically you need to bring yourself back on track whenever you feel you are veering away from the track, and I think you'll be fine. You need to say to yourself that you'll be good and you'll be fine, and probably sticking to your schedule is the most important thing. I was a person who was not that disciplined in MBBS. I thought in MBBS I've hardly made a timetable ever in any of my exams. So in this initial 6-7 months also, I didn't feel the need to actually stick to a timetable in its entirety. But post say October, I felt that timetable and that scheduling is very important, because that gives you the account of each hour that you're spending, because finally at the end of the day it matters how much you're spending time in front of the books and in front of the MCQs. And if you're able to give an account to yourself, and if you're able to justify to yourself that you're spending your time worthwhile, and I think that's going to help you in the exam, and not any particular advice or probably I think that's your biggest motivation. If you feel you're on the track, I think that is the biggest motivation.
Any particular teacher that comes to your mind today?
I think definitely Dr. Sumesh sir and Dr. Deepthi ma'am, they need no special credit from my side. They are the gold standards in their respective subjects, and not just their subject. I think it was a feel-good factor when they actually went so much out of the way to make us feel comfortable right from the beginning till the DVT, where they were constantly trying to boost our morale up and trying to make us believe in ourselves, because I think that's very important in this present scenario where doctors are perhaps not held in the brightest of light. I think we ourselves need to hold ourselves in a particular esteem and think that we are worth all this effort, and the effort that we are putting now is going to take us to a better place in the future. So if that goes well, I think your mindset and your head needs to be clear for you to achieve in any of the exams. So they both come to mind, and definitely I was in touch with you, sir, right from my NIMHANS exam and after that, and I think speaking with you gave me a clarity. I could resonate better on what I wanted to do in particular. Also specifically I would like to mention Dr. Thiru sir, whose pharmacology class I thoroughly enjoyed, and even some of the younger faculty, Dr. Vivek sir, Dr. Bharat sir, and all of those teachers, Dr. Anshul sir, they come to mind, wherein I felt their notes were so comprehensive that I actually felt relaxed reading their notes, rather than as a separate burden that I have to read anesthesia in separate, or I have to read urology as a separate subject. I could really breeze through their notes. So it wouldn't be fair on my side to actually point out any teachers, because all of them have put in their heart and soul. I think that is very important to recognize. For example, speaking about medicine, for example, one of my friends, after watching the ECG mop-up videos, she was saying that yeah, I feel I have to do well in medicine just because Arvind sir is putting so much effort into this. So I think you can take inspiration from all that. Basically I feel there is no point in people doing so much of work to make us improve if not for their passion. So I think retaining that fire inside you is very important to actually achieve and actually get into that high echelons of the entrance examinations.
Any last minute advice you want to give from your side in general?
Last minute advice is that for those of you who might not have got a very good rank in AIIMS or in the exam so far, I would advise you to keep your confidence high, because NEET is coming up. Still PJ and JIPMER exams are there. PJ is over and JIPMER is on its way. So you never know where you will get the seat, because all it takes is one seat, one good day to crack the exam and get into the seat which you desire. So to keep our confidence high and to keep going is the first mantra. We have to keep moving ahead. There's no point in actually sitting depressed and feeling low about getting the low rank if you've got it. If you are in probably the internship or giving your first attempt of NEET, I would advise you to probably read as much as the notes as possible and stay confident that you can pull through the exam, because the interns will be actually in touch with the patients and in everyday scenarios, so they might be able to do certain areas better than us post interns. So I feel each person preparing for the exam will have a strong point. He'll know what his strengths and weaknesses are. So focus on your weaknesses specifically. Don't listen to a lot of advice. You are your own best teacher, and if you trust someone genuinely to give you good advice, you will listen to them. But otherwise, it's better to maintain that bubble around you and maintain that one or two friends or your parents or the close circle around you, so that you don't actually falter in the main exam due to pressure or stress on your head.
Thank you so much, Madan. Thank you so much for being here, and thanks for the great advice. I hope the students will appreciate this and will apply the things you have said, and they'll use it for. Last question before you finally disembark is which branch you want to specialize in?
Sir, I'm looking at MS General Surgery in this AIIMS, hopefully if I get it. So I'll take it from there.
I wish you all the best, you get it. Thank you so much, Madan. Thank you for that. Thank you.